Did you log in with Zoom admin? Sarah, can you hear me?
Yeah, I can. Yeah.
Oh yeah. Okay. Sorry, I couldn't get on there.
Carl, I'll just maybe go to WhatsApp because this part is part of the recording.
Enjoying this afternoon. Yeah.
Hi.
Sorry, I was just in a meeting with Thomas Love and.
Sure. Do you know how to cross off the names on it? I need to just know.
Yeah, so is it the same one that you sent me? It's just all on the
Yeah,
phone.
I've nearly finished it now. I just want to get rid of the names.
Yeah, no problem. Which page is that? Because I just have to just take out the picture from here, then edit it and then.
Oh yeah, it's in my pictures. You want me-
okay.
Well, I forwarded to you. Send
Yeah.
it, save as a set, share.
Yeah.
Oh God, mail. Yeah, I just want to take out the patient's name.
Yeah, no problem. I'll do
No,
that.
that'd be great.
Is there
How did it
anything else?
go? I have enough to.
It's fine, like we apologize again and said. Again.
Now, you're very welcome, everyone, to our webinar today on interoperability in developing a digital health application. So we have very informative and distinguished speakers with us today. We've Tom Coleman of Zendra Health, Larry Breen of Nearform, and Adi Stack of Stack Pharmacies and DigiCare. And so we're going to kick off today with a short video on what is interoperability and why is it important in a European-wide context. So I'm just going to show you that video now.
Amounts of medical data are generated across Europe every day. But much of this information isn't maximized to its full potential.
Can I just check, can everyone hear the audio on the video?
Yes,
Okay, thank you.
it could be maybe a bit louder, but we can see the subtitles.
This year by the European Commission seeks to change that by making health data more accessible to both patients and medical professionals. There are two types of health data. Data related to healthcare is known as primary use. Secondary use refers to information that is processed under strict security and confidentiality conditions, for instance, in policymaking or the improvement of healthcare products. Sharing medical data is seen as one of the best ways to foster growth in the digital health sector, as it should overcome the current fragmentation of health standards in Europe. In Greece, organisations like the IAG say common specifications will promote business opportunities.
In the European market, the e-health sector and companies face various obstacles. Indeed, the e-health sector constitutes a fragmented market, and that is to the detriment of European citizens, unlike what happens in the United States and Asia.
Currently worth around 40 billion euros, the European digital healthcare market is on course to keep growing. Companies like Gnomon Informatics, a digital health product specialist, say the coordinated exchange of data would create a Europe-wide market benefiting both patients and business.
Modelling medical data is vital for European citizens, as well as for the rest of the world. A patient can have all their medical data and medical reports on one device. In this way, they can have the data with them when travelling through different countries, and they can share that in any clinic and with any doctor they want.
Improving interoperability between healthcare providers across Europe should also reduce duplication, for instance, with medical tests. That should have a positive effect both on healthcare costs and patient follow-up.
In terms of the architecture, The use of a European data space is the right approach for e-health systems. It gives direction, enabling Europe to create an electronic health industry and offer quality services.
Linking medical and digital ecosystems relies on interoperability, allowing IT systems to read, use, and exchange data. The semantic data model will be key to bridging the terminology gap between various healthcare software systems. The next step will be to agree on sentence structure with regard to how the information is received. Once fully implemented, the European health data space should open up Europe's health market and enable small and medium-sized firms to work with each other to develop innovative new products.
Just going to shut that down now in case the next video auto plays. Okay, so we're going to move on now to Tom Coleman of Zendra Health. And Tom, I'll let you take it away. Tom is going to talk to us about interoperability and how to figure it into innovation. Okay, Tom, I'm going to hand over to you.
Okay, thanks very much, Sarah. I'm just going to try and share. Can I share my screen there, Sarah?
Just let me make sure that you can.
So thank you very much, Connected Health Cluster, for this opportunity. It's really good to be here. It's a privilege to be up there speaking with Aid Stack and Larry Byrne. Yeah.
Can I just check there that the participants can see your screen? Have you shared it there, Tom?
No, I still don't have permission to share.
Okay, let me just check that for you. Sorry, Tom, just bear with me a minute.
Yeah, no problem. So while you're kind of looking into that, I suppose what I'll be kind of doing today is really just touching on how to approach interoperability with healthcare solutions. And Aid and Larry might kind of go more into a technical kind of detail. So what really cover is initially a bit of technical information, but then other aspects that feed into our stepping stones towards interoperability. So thanks very much, Sarah, for that. Okay, so and yeah, so yeah, good to see you all here. You can see me on screen there as well. So just going to, can you see my screen, everyone?
I can.
Yeah, very good. Yeah. So before we kind of go into kind of the detail, just want to give you some background context as to what Zendra Health is all about. We're a medical technology company, and really we're kind of an IKEA for digital health solutions. So we built digital health solutions for the likes of Stanford University and Apple, and we're in over 40 healthcare services and medtech companies, helping them digitalize their care pathways or develop software as medical devices. See this little NACI badge there? That means we've got the expertise in technology to develop software as a medical device. But enough about Zendra, and let's go back. If somebody might have seen a presentation last year, you're going, oh no, Tom's reusing his pitch deck here. Don't worry, it's not the case. But what we're going to do is looking from potentially your perspective as a scale-up, as a startup, maybe a healthcare professional. In this case, it's Linda. She's a hand surgeon, and she's looking to digitalize her care pathway for flexor tendon repair surgeries. That tendon that makes you bend your finger and thumb. She's got a very good idea. She's done the best practices in terms of co-design and so forth. But she's heard kind of rumors in the grapevine about interoperability, and she's gone like, "What's the big fuss about?" Now, have you ever been at a party where maybe you don't know that many people, and it's pretty awkward? You know, I feel guilty of several times myself, where I kind of check my phone too many times, or I've actually, confession, like pretend to have calls with people because I've just felt that awkward. Well, that's what not being interoperable feels like. And the dangers of not being aware of interoperability is that, first of all, you know, the lone wolf approach is outdated. In healthcare, or in medtech, in basically the modern world, it's all about being a team player. And this feeds into, if you're not interoperable or not aware that you need to play with other vendors and seamlessly integrate with them, it shows a kind of naivety and a lack of awareness of the major pain points that have been haunting healthcare since its inception. You know, you could see things that are mentioned there in the video in terms of sharing information across regions and so forth, but also paper-based systems clearly haven't been listening to the key pain points as to why they want to digitalize. And with that, unfortunately, if you kind of siloed approach, people might just be more suspicious, you know, are you trying to take everything? And this unfortunately can lead to less partnerships, maybe less trust, and lost opportunities and lost revenue. So how can we go from this to being the life and soul of the party and being interoperable with these other players that we have in the system? Well, first of all, is gain technical awareness of interoperability. And notice that I mention awareness. It's not expertise. And that's a big pain. So I learned you don't have to be an expert at everything, but just be aware of it and then look for people that might be experts at it and that can help you. Okay, so one thing is that, like, if you're storing data for your solution, ensure that it's using open healthcare standards. And one very common one is HL7 FHIR, okay? And if you don't know much about that, look for a vendor that is familiar with it. Have to develop solutions for that before. Consider other healthcare standards that are coming up and being introduced into healthcare organizations. And that kind of shows a real awareness and empathy, which, you know, as you're doing customer discovery, you know, within the healthcare sector. So for example, within the HSE, there's a real drive for SNOMED CT. Okay, that's a kind of standardization of the kind of like clinical dictionary terms, standardizing that. All right. So, you know, maybe incorporating certain facets of that and being aware of what standards have been introduced to where your target market is going to be very beneficial. And the last point I'm going to give on the technical aspect is it kind of ties into the first point, if we'll be honest. If suitable, consider developing an API or a kind of gateway into your solution so that other vendors can integrate with. Okay. So that you're a player. And just one kind of note is that if you do have the API exposed, make sure the documents, which is almost like your front of house, are in really good shape, because that's the first impressions vendors will have. If your documentations for APIs are out of date, it causes churn and it just doesn't, you know, it doesn't leave as good an impressions. Just wanted to give you a little heads up on that. So if we go back to the definition of interoperability, it's the characteristic of a product or system that works with products or systems. But what I'm going to just really focus on is almost a stepping stone to interoperability. You know, before you even get there and talking about technical, there's other items to consider on a broader context, such as social, political, and organizational factors. Okay, so really, there's really important factors to consider as you're stepping stones towards interoperability. Is use of client's language. All right. So make sure that you're speaking in the client's language. So in Linda's case, as a hand surgeon, it's probably comfortable when she's speaking with clinicians. She knows the language. But for someone like from my background, which is technical, that took me a long time to learn. Just to give you an example, you know, we used to describe, like many companies struggle with their value proposition, and then all those are fines. But we used to say before, oh, we developed a no-code platform to digitalize your care pathways. We lost clinicians at the word of no-code. They didn't care, and I don't blame them. So we just put in analogies instead that they get. It's an IKEA. They get the hook and go, okay, it's the kind of like, it's a hook for the next kind of question. All right. And that's really what you want. You want to kind of turn that monologue into a dialogue. And with that then is when you're kind of like, you may be doing customer discovery, is try to familiar yourselves with the client's terminology. You know, so you're aware of like maybe what medication or is the pronunciation of even simple things like that, because it just shows that like you're speaking my wavelengths and you know you've done some preparation, and I like that. And on the flip side, be aware of trigger words. We've all unfortunately, you know, working lives and personal lives, you know, had experiences, particularly in projects that might have just hadn't gone the way you hoped they'd like to, and the same applies in healthcare. There's projects maybe that are paper-based or systems that were introduced that did not work. Okay, they did not go into plan, and like with all the best, like, you know, efforts at hand. So, and sometimes that can be associated with some words, you know, with some solution. So be aware of that and know when to navigate or use an alternative wording for that. Okay, so it's all about, you know, like aligning with the client's language. And another thing to consider is the cultural fit. So before you even actually think to talk about interoperability and putting your solution there, are you interoperable with their culture? Like, is your client culturally ready? They may seem like a really good bunch, but are there at least one champion within the team? And really, I'll be honest, you need to be looking for two, Because they might be great, but it's like you might have to be aware there could be a lot of hand holding if they're not kind of ready yet, and you might need to come back to them or get some other people or expertise to give you a hand with that. Okay, and from a champion's perspective, just to give you from our own experience, about 4 years ago, there's a project that was kind of ready to kickstart within 6 months, and we had one champion. Unfortunately, that champion retired, and that was it. The project was just, didn't kind of progress, and that was our kind of like, it hurts, but you learn. And so it's all. I just recommend try and look for at least 1 or 2 champions, evangelists, and also because this is pretty kind of hypocritical from me being a male and a white male, but given that the kind of like within the healthcare sector that 80% of the industry is female and it's very diverse. As you're scaling your company, so you mightn't have much flexibility initially, but be aware, does your diversity match theirs? Okay, and just something to be, take into account as you grow your team. And again, in terms of interoperability, let's kind of dial into the systems. So you can talk about technology all you want, and FHIR and APIs integrating with electronic health record systems, but unless you've done your homework, not done enough of your homework with the workflow fit, your product is doomed. Okay, so always design your digital health solution to integrate seamlessly into their existing care pathways. If unless it's electronic health record system and your clients need a day of training for your solution, that's not a good sign. Okay, so ask questions such as, what devices do my stakeholders use? Is it kind of like, what's their tech and literacy? And make sure that your solution fits in seamlessly in not alone to their environment, but also, to their workflows. Okay, that it's really almost like a digital twin of what they already work with. And just to give an example, we spend, I'd say, sometimes 50% of the time telling people you don't need an app, because there could be situations where maybe it's a restricted environment where, for example, in HSE, they're getting more cyber attack, unfortunately, but understandably, it's just more restricted in terms of what apps can be installed on staff phones. Or maybe your solution is more for sporadic events, and asking people to download an app for maybe a once in a year event, it's a bit too much. They've forgotten the Google Play Store account, IDs, etc., etc. So just be very cognizant of that. And also, just be aware as well, like what you might envisage as terms of rollout in healthcare could be significantly a lot slower for items that are just understandably out of your control and their control. Just let's give COVID, for example, an example. A lot of elective surgery was postponed because of COVID. Things might happen. Staff kind of might be turnover, and there might be just mention of setting up a steering group, which is obviously ethically and clinically makes perfect sense. That takes time, so just be aware of that. All right. And also in terms of interoperability, as it gets a stepping stone, does your pricing align with your kind of the prospects and how they're funded? And again, just to give you a kind of war story, like with 3 years ago, I was doing a kind of customer discovery call with a healthcare service, and it's going halfway through, and I was high-fiving myself, going, "This is going, really good. What beer am I going to have tonight?" And then we got to the pricing section, and it was just like a record scratch. It was like, I was Gareth Brooks and I turned up at a Metallica concert. It just didn't go well, because it just showed a lack of awareness on our side that our price model didn't align to how they're funded. Okay, so this again, it's just another kind of like little stepping stone towards interoperability. You can build a tech like as highly interoperable as you want, but unless you take these other factors into account, you won't even get to that conversation. All right, and lastly, I'll kind of like I'll end with kind of a heavy kind of like buzzkill note, but more it's on just the regulatory fit. Okay, if you're dealing with a vendor, maybe it's a medical device manufacturer or a healthcare service that's doing something that's quite interventional or that might supplement or replace clinical decision making, does it need to be classified as a medical device or a software as a medical device? And if so, do you have the expertise to fulfill that? To be the contract manufacturer where they are the legal manufacturer? Or how do you do that? Should we actually get some other expertise involved? Are we the right fit? Okay, because, and even if you think initially, it's our solution, it isn't a medical device, but it'll get quite interventional 3 years' time. It's much better to actually get your regulatory roadmap aligned with your commercial roadmap and product roadmap from the start, because it makes your kind of pathway to getting it classified as a medical device eventually much easier. Okay, so just be aware of maybe standards. There's depth by kind of standards. I won't mention them all here, but ones of particular importance would be IEC 62304 for software as a medical device, and ISO 13485. And there's two other ones which kind of overlap as well with the other standards. So really, I suppose what I'm kind of stating is that, like obviously being technically aware of the items you need to address in terms of interoperability is very important. But as stepping stones towards interoperability, you need to kind of figure out, how do you fit it into that, in with your clients, in with partners from a language perspective, cultural perspective, workflow perspective, financial perspective, regulatory perspective. There's one other term there, and obviously technical as well. Okay, so I'm more than happy to take any questions at the end of the session, and thank you very much for your time.
Thanks very much, Tommy. Tom, that was really informative and very down to earth. And that's exactly what we need and what our clients need. So I'm going to hand over to Larry next. And I'll ask Larry to turn on his camera, please. And I'm going to make you the host. Thank you.
Everybody. All right. So I'm Larry Breen, Nearform, but also from a company called Santegic. So we're going to talk about interoperability and accelerated digital health. From a Nearform point of view, we'll be mostly known for the COVID app as of late. So obviously we're all still experiencing COVID. COVID unfortunately is not over. In the height of the pandemic, we were called to action to actually come in and help support that. And we'll talk about that a little bit. Santegic is basically a digital health accelerator that we've brought out of Nearform to very much focus on this whole health market. I think Tom did a great job. He touched on so many different parts that when we look at these things like interoperability, we all get focused on the technical side of it, and we'll kind of touch on some of that in a second. But there's so many different facets that actually go into a lot of these deployments, a lot of how they actually work. Even so much when we look at budgets. So I do a lot of work with different public health authorities and governments across the globe and on an advisory capacity and working on projects with them. Typically on average, 20% of the budget they're allocating to a new system, so bringing in a new technology or buying a service, only 20% of that is actually for the technology and initial implementation. The other 80% is around the cost of bringing into their ecosystem, training up people, adding all the elements, process changes and disruption to their business. So it's important, I think, Tom made the point, is there's multi-facets to understanding how these kind of things work. From a rapid response to COVID, so interoperability was kind of key. And this is why it's kind of a good message to kind of get out there. So as we all knew, COVID came along, everybody sort of jumped to attention and obviously needed to drive forwards. Get on top of it as fast as we possibly could. The challenge that we had with it within health, and quite unusual, is normally within this kind of health setting is we have a runway up to it. So these things we can see coming, we start to get small levels of activity, we can do some research, we can start to build out toolkits. So by the time we actually get really hit by it, at least we've done some of the foundation work. There's still a certain amount of reactivity to it. COVID came upon us like nobody's kind of seen before. So again, normal rules of play were thrown out the window. It was really a case of let's get going and fly as fast as we possibly can. One of the areas was to try and stop the spread or reduce the spread of it by identifying folks who were infected and stopping them from infecting and passing on COVID to others. Now, the idea behind it wasn't necessarily that we were going to stop people from ever actually getting COVID, but if we could limit the transmission of it, it would allow the health service providers to actually maintain some level of control over their environments rather than being overwhelmed. For all of you, hopefully in Ireland, you've all used the COVID tracker. It's still out there, it's still available. But what we did is we obviously built out that COVID tracker, and we built it out for Ireland initially and worked very closely with the HSE and Department of Health. But very quickly, we spread it globally across the world. So we ended up obviously putting it out to 9 different countries, but we supported a multitude of other folks that were out there. And part of the principle that sat behind it, and part of the principle sitting behind Nearform and how we operate is it's about building those kind of scalable, workable solutions that actually deliver value out there. And to that end, we also have been very active over the years within the whole open source community. So we took this as an opportunity to open source the product. So once it was up and running, open source and make it freely available to anybody that wants to use it. At the end of the day, we're all in the middle of a pandemic. We're all fighting on multiple fronts. The last thing we needed to worry about was, who could or couldn't actually, play with the system. That's all great and super, and it was, the most successful app, and we took a market-leading position and stuff in that from that perspective. But key and why we talk about it today is obviously interoperability became essential. So if we start just with the island of Ireland, we obviously have, Northern Ireland and the Republic, and obviously between the two, we've obviously got different health systems and different governments and stuff that are actually driving forwards with different policies, et cetera, et cetera. So what we needed to do, and we were very driven in terms of that whole conversation, was to see how could we actually build a system for the HSE and build a system for Northern Ireland, but then again, create that interoperability for it. So what we didn't want is, for somebody who's living south of the border to have to carry two apps. Part of the challenge you have with that is it creates all sorts of conflicts and confusion over data. The way the underlying systems and technology that runs underneath it, they create a conflict. So you can actually only run one contact tracing unit at a time. So if we have people on HSE systems traveling in Northern Ireland, we needed them to be covered, and we needed the Northern Irish folks to be able to come down south. And again, just not worry about it. Again, remember, key to all of this, when we dial it all back about, being patient-centric, the patients don't really want to care how it works. That's our job. That's for us to worry about the nuts and bolts that sort of sit in behind it. All they want to do is press a button, or ideally not even press a button, is just agree to do something. It takes care of it. They're minded and they're looked after. So we were the first to set up that interoperability. So we started doing what we call key exchange between the different COVID apps, so north and south of the border. And as soon as we kind of got that up, we started to look at that from a pan-European point of view. So one of the great things and lovely experiences of working within COVID, quite exhausting, but lovely, was we ended up seeing public health authorities across all governments, not just across Europe, but globally, all coming together to share standards and to talk about how we'll actually make these kind of things work. Again, when we started rolling out across North America, so within North America, again, each state is its own entity in its own right. It wants to do its own thing. It has its own policies. It has its own health information. Quite often it has its own politics, which influences the decision-making that's kind of going on. So they need to be autonomous in their own right. But obviously, people are driving back and forth across state lines on a regular basis. And again, we need to make sure that we have that kind of level of interoperability going on. So again, we took the learnings that we took from Europe and brought them across into the US and made sure that as we brought multiple states, especially neighboring states, live within the system, is obviously we were able to do that key exchange. So sitting underneath the data that we're collecting, it's being made available to everybody who potentially could benefit from it. And doing all of that, again, in a trusted, very secure, privacy-preserving way, sort of sits in about it. And we'll kind of come on to that in a little bit. So that created that as a sort of a challenge and drive forwards. And, we were super successful. So we were able to, spin up an app within days, get it out there within months, get mass adoption literally within days of it actually being released. So it was a fabulous success and continues to sort of underpin some of the COVID actions that are actually going out there. Quickly along came vaccines. Great, happy days. So all governments and pharmaceutical companies and research organizations, academic institutions, everybody just plowed in and worked on how do we actually create vaccines and boosters and everything else that kind of go with it. And we see that sort of rolling along. We've just had the latest version being released by EMA today. So, we're starting to get more specific vaccines into folks' arms, which is brilliant. But with that came the whole vaccine cert. So why were the vaccine certs important? Well, initially it was for local use. So we had certain sort of needs in terms of going into certain environments. We needed to be able to show that people were actually vaccinated and they had some level of protection, again, to do risk mitigation. But, as we started to learn to live with COVID, international travel is part of our everyday life. So again, we needed to do international travel. While we're working on a domestic basis, it's okay because we're fortunate here. We have one health authority, we have a single system, and that's great. But as soon as now we start opening up our borders and we start getting back to traveling, as most of the people on this call have experienced, obviously you want to go off to Spain or the UK or somewhere else. Again, we needed to make sure that we had a vaccine certificate that we could actually present in the country of destination. What we needed to be able to do also within that is make sure that it worked on an interoperable basis. Okay, so what we needed to make sure is that the coding that we were using and the QR codes and the information that we're actually providing was agreed upon, that the standards were actually there, and that we were able to, take a digital vaccine cert that we've created here in Ireland under the HSC and transmit it out to our population. And I could walk into Spain and present them with that, and they'll be able to recognize it, accept it, validate it, and feel comfortable that the person in front of them is actually up to date on their vaccines and boosters and all the rest of it. So we put that forward as a very key example in terms of the impact of interoperability and why it's essential. And COVID is just a very simple example of how that needed to be done. And to be fair, getting into the weeds that sit behind it, again, it was a very limited data set. Because we had that level of cooperation and a sense of urgency behind it, it was again, we were able to come to those kind of conclusions very, very quickly. And again, going back to some of the points Tom's already made is, it wasn't just about the coding side of it. So, how are we structuring the data and sending that across? And it was making sure that, programmatically it sits and it reflects what we've actually agreed on a political basis, what we've agreed on a process basis, and making sure that everybody's on the same page. So a lot of interoperability have a lot of those kind of layers and facets and stuff to it. So from a Nearform point of view, as a Nearform partner, we continue to sort of drive forward and support folks. The apps that we support directly support a population of over 55 million. The kind of adoption. So when we launched in Ireland, we went from a 0 penetration to, I think it was like 1.3 million within the first sort of 48 hours. So it was that kind of scale up. And as we roll that out, we needed to make sure not only does it actually work in terms of the app, but again, that interoperability had to be there. So it's about garnering people's understanding and kind of respect for it. And key that sits down there is we needed to make sure that we have that circle of trust. So people needed to be confident in what we were actually doing, make sure they're confident that we're not abusing their data, that they're secure, that they're safe. And again, very much within the COVID side of it is we have a very limited amount of data that's actually being used. And we needed people to kind of understand how that actually works and that they're not exposed and their privacy concerns are actually addressed. If we start getting into more of the technical, let's go back again. Getting more into sort of the technical side of it. We're not going to go super deep. One, we don't have the time, and two, I don't want people kind of falling asleep. We've kind of touched on it already. Interoperability it must happen. So it's out there. And what you need to be doing, again, is you need to be architecting for success from the outset. So what you need to be working on and what you need to be very focused, obviously, in any digital product that you're building out there, is you want to make sure you got solid architecture that's supporting that sort of integration, abstracted integration layer, regardless of the whole interoperability piece. You just want to make sure that that's there as part of your foundation. And if you're not doing that from the get-go, I'd suggest you go back and have a rethink. Doesn't mean it needs to be the first part of your product roadmap, but it very much needs to be an underpinning that's there in terms of thought process from the outset. If you get that thought process right from the outset, obviously it makes it a lot easier as you start to move forwards. Doing it on an abstracted layer, again, there's pros and cons. Personally, if you can do it on an abstracted layer, obviously it allows you then to have greater flexibility as you're kind of going forwards. And we're not going to delve into the detail. Again, feel free to stage come back to us with questions and stuff on it. But when we then start getting down into health data, so looking at interoperability of health data, it's super important. And again, Tom touched on it a little bit earlier. So if we look at a data flow, so simple diagram here, got red hospital sitting on one side of the screen, blue hospital on the other, we need to move data across. So first of all, we got to extract the data from whatever system. So, and that's no small task. We need to obviously understand the systems there. We have a growing number of modern systems and modern protocols and that make it easier for us, and they themselves will have some level of API layer that we can actually hook into. But also do remember, and don't underestimate it, there is a huge volume of legacy systems, depending on where you're working and where your target market is. There are a huge amount of legacy systems, and they need to be understood. So again, go back to some of Tom's point, is understand your market, understand what you're getting to. Not everything is as easy as it ought to be, unfortunately. But again, do have a little bit of patience and understanding. Some of these big legacy systems have been 30, 40 years in the making. They do so many things that are out there. They're not easily replaceable, but they will change and happen over time. We then obviously extract that data and we start looking at the semantic terminology that sits in behind it. And again, we kind of touched on it before us. We need to make sure we're using the right words. Okay, so we all have our own local vernaculars, even when we're talking. So people up in Drogheda versus people down in Waterford will call things different things. That's just part of our everyday language. The same applies in industry, and particularly when you start getting into healthcare. The challenge that you have is you need to make sure that from a semantic terminology point of view is we've actually got the right words and descriptors that we're actually sharing. And there's a bunch of standards coming out sort of sitting behind that. So from SNOMED and a few others. So again, what we're looking to do on that side of it is make sure that everybody understands when we talk about an apple, what an apple is. And it's clearly understood. So therefore, as we're passing it forward, we can do those kind of conversions into local terminologies if necessary, or ideally just get everybody talking on the same piece. The next bit then is getting into syntactic structures. So again, obviously data from all these various systems, and anybody out there in the audience who's built systems, you'll see people structure their data in different ways and different approaches. If we're going to get truly interoperable, we need to actually have a look at those structures and try and stick to some conforming standards. By doing that, obviously, it makes it easier for us to actually translate information, pass information back and forth. We then get into physical transmission, which is, just sending it. So at that point, we're obviously sending it from one system to the other, but then we have to do the reverse to back it into the receiving. So as you can see, there's quite a lot to it just from that point of view, and that's without getting into the deep, dark coding side of things. Tom touched on it. We have things like SNOMED, we have HL7 Fire. There's a number of other standards that we're kind of working on globally across the industry. Fair warning, there's always that debate over getting a unified global standard. That's always a difficult one. So we will have geographic specific standards, unfortunately. Aspirationally, we obviously want to get to one, but what we need to do is we need to start boiling it down, where before everybody had their own unique standard, which meant it wasn't really a standard at all. And what we now need to do is obviously diminish that to a more manageable level, and ultimately over time is getting to something that's kind of consistent. Another area just for consideration is obviously we do need to look at security, we need to look at consent, we need to look at verification. They're all key aspects of health data in particular, more so than anything else, and we need to be extra precious on that side of it. Looking at immutability, trustworthiness, and verification. So again, we're getting back to that whole piece again. We need to make sure that the data going through this process is immutable, so there's no debate. Remember, Tom kind of touched on it. We have standards, because if we're using software as a medical device and so on, we need to make sure that we're obviously sticking to those standards. Those standards are there, and those certifications are there for a very good reason.
I might just ask you to wrap it up now, if you can, in the next minute.
Yeah, in the next minute. Okay, let's jump onto that one. Final question: cost. Simply put, can you afford not to do it? If you want to play in this space, if you want to be part of the healthcare market, you're going to have to embrace this. It doesn't have to break the bank. It doesn't need to be super scary, but you do need to put it on the table as part of your initial planning. If you've already started down that planning route and it isn't on there, as I say, come and talk to somebody who actually knows what they're about, somebody who has that kind of experience. Get it into your product and company roadmap super fast, and it's not rocket science. Thank you.
Great, thank you very much, Larry. And I'm going to move over now to AD Stack. AD has developed an app called DigiCare based on the premise of interoperability. As you probably all know, the EU has said that we will have electronic health records across the EU by 2030, and therefore interoperability will be a must at that stage. So Adie's going to talk to you now about how she built an app on the basis on the premise of interoperability. So I'm going to hand over to you, Adie.
Great. Hi guys, can everyone see my screen there?
Yep.
Great. Hi, so I'll go back. Can you see me now?
No,
Your
I
name?
see. I can't see your video. I see your screen.
Grand. No, well, look, my name's Adie Stack, and I know nothing technical about interoperability, but I suppose culturally, I would say as a tech startup, we felt it was really important to have interoperability at our core.
Adie, can I just tell you that your presentation isn't in present mode if you want to click slideshow there?
Is it on there?
If you go to slideshow, 80. Yeah.
All right, here, 1 second here. Apologies. You just still looking at me?
No,
we see the presentation.
Yeah.
It's okay. 1 second now. Apologies, guys.
No problems.
What? I don't know what you can see there.
We can see the slides down the side, so it's not important if you can't figure it
Grand,
out.
no, that's fine. I'm just on the I'm just on the home one of intelligent workflow.
Yeah, that's fine.
Yeah, great. Okay, that's what I thought it was. Sorry. Yeah, so we set up a company at the just start of COVID about 2.5 years ago or 20 decades ago, where suddenly the work we were doing every day, going into hospitals and nursing homes and supported care facilities, we were kind of locked out of them. So that was the driver of why we started developing a software. And our key aim was to allow us to do what we were doing on the ground in front of somebody, to be able to do that remotely, while many of our other colleagues were suddenly, over a matter of 5 to 6 weeks, having to move remotely. So in regard to semantic and all of that, I am not going to be your technical advisor for the day, but I'm probably just going to explain a little bit about how we started to look for where we should begin our interoperable journey, because we knew we were a system that was designed for sharing, and we wanted that whatever we were, what we would have previously been saying in a Teams meeting or one-to-one to a healthcare colleague, we wanted that wherever they were in the system, with regard to medication, that they would be able to find us easily. So one of the first places we went to, I'm just going to click down on my slides, is, I don't know if you can see eHealth Ireland slide there. Can everyone see eHealth slide?
No, it's still stuck in your first screen, Katie.
Okay, there. Apologies.
If you click on it on the left-hand side of your screen, we'll be able to see it.
Left-hand side, nothing is happening here. Oh, I suppose, look, I'll talk through it, because the slide is just saying that we went to eHealth Ireland, and in there is actually quite a good roadmap of where certain forms of easy to standardize interoperability, software that eHealth Ireland is using to try and improve technology throughout the healthcare system. And two of the ones that we immediately, like SNOMED that was mentioned earlier, is there. And that's really important that we're using the standard terminology, that is a key thing. But equally, we decided to look at health mail and also about the National Medicinal Product File. So the National Medicinal Product File is part of a larger project throughout Europe, where there is going to be a standard product file. There has to be a standardized product file, and that will be the law that we have to use it by the end of this decade. But the EU, since about 2014, has spent nearly 80 billion on trying to standardize medicinal product files. Because if we really want to get into data analytics, we want to get into deep into helping better decisions, better data analysis, we have to all be talking about the same products. So one of the first people that we approached, and we also used it in another business we were in, was the people who manage the National Medicinal Product File. And that's used by GPs, hospital pharmacies, it's used by all the state agencies when they're talking about everything from food supplements to prescription medicine to chemotherapy to vitamins, and anything that would be seen as being in that category is categorized in the National Medicinal Product Catalogue. And when we contacted them, I suppose this is just to give people encouragement, they were really happy that we were going to be using it. Now, we do pay them a license fee, but initially they were really, really supportive of having that another solution for in technological terms was going to be standardized on the National Medicinal Product Catalogue. And the benefit for us is that we get an update at the start of every month of all of the new medicines, all of the new products, if there's any change in warnings, if there's any changes in, let's say, how a medicine should be managed, that was all going to be standardized and automated for us. And for anyone who's going to be looking at providing any information on data, it's really important that you are involved in a source that will automate that. So we were not going to have to update a product catalog every month. We update it every single month. We remove any discontinued products so that they can, while they may still be prescribed, currently no new prescriptions can be added for them and things like that. And if you were going to do that with a new product and try and manage it yourself, you're going to fail. It's just not going to work. The second item that we use from eHealth Ireland, and again, in this product has no charge, is eHealth Mail. And every single doctor, hospital, registered centre in Ireland has a health mail address. And when we were looking at how we were going to communicate certain documents or certain parts of our service that could not be done through like an API, that there was maybe a document that had to be moved, we decided to use healthmail.ie, because every single person, whether that was a pharmacist, a doctor, a nurse working in a hospital, a sheltered housing, they were already registered on it or could register in less than 24 hours. And that gave us a closed, secure way of communicating data through something that was already tested and in use by them on a daily basis. So sometimes it's really worth, I suppose what we're saying at the start of, it's really worth seeing what the state and the government and wider EU are trying to do and see, can you benefit from the standardization that they're already bringing in? And if you go on to eHealth Ireland, you can see information on healthmail.ie and also on the National Medicinal Products Catalogue. Some of the other things I would say as a startup is that sometimes people try to integrate too many fields. When we wanted to integrate with a company called vCare, who do a lot of care planning in nursing homes, we actually started with about 20 fields. And we also worked really hard to say, how often do we actually need to synchronize this? So again, I may not be using the right technical terms, but we started with what's their name? What's their address? Do you mean their home address? Do you mean their location in the hospital or nursing home? What's their date of birth? Who's going to be who is in charge of allergies? What happens when, is the newest always correct? Who can overwrite who? How often do you synchronize? All of those things are things where if somebody can, in an interoperability, you still need to know who's in charge of the fields. And that's something that often takes a bit of working out and talking to, because it may vary by your user and the user group that you're working with. So for us, if the centre says that they're admitted, it doesn't matter whether we have them in pre-admission. If the hospital says that they have been admitted, well, they need to be assigned to a bed number and to a location in the hospital. If they're discharged, how quickly do they go to archive? Who can pull them out of archive if somebody does that, accidentally discharges them and they actually don't leave at all? The ambulance doesn't pick them up. So again, it's really important that when you're looking at interoperability, it's really important to know who is the ultimate decider of who is in charge of that information that you're sharing and who overwrites who on backups and things like that. That is really important. sometimes another thing on interoperability is to try and remove free typing, because if you want to move data around, try and reduce the amount of free typing that anyone can do in your system. So if they're selecting a medicine in the hospitals and nursing homes that we look after, we don't allow them to free type the product. They must pick it from the drop-down menu. And that obviously, as they type more letters, gets shorter and shorter. But it means that we don't have any information that's being missed from the system. Excuse me. And another reason, if you are, other suggestion I would say is if you are using drop-down menus, to make sure to be aware of the Corbally judgment in the Supreme Court in 2015, where it was highlighted that some of the drop-down menus that had caused some of the errors that were investigated in that court case were due to the fact that the drop-down menus didn't have an other option. I know it seems really obvious, but your drop-down menu must always have an other option, so that if whatever is there isn't what they want, they can actually enter it. And that needs to be monitored really carefully, because it is really important that you can go back. You have everything on your core data in a way that the previous guys were saying, that it can be moved safely. And to do that, it's much better off if you don't have free typing. Another thing we'd say from interoperability is to look at what is the software that other people who are going to be using your app or your system are using every day. Sometimes we found that some people were more inclined to choose our software because we didn't make any of our own icons. And I know that sounds like a strange thing to be saying in interoperability, but that it is that sometimes they were we use the pause button, the stop, the go, and a traffic light system. And we found that that sometimes people were uncomfortable with certain sharing because they didn't understand what the buttons or that the icons looked really, really complicated. And if you are looking to get people to use it and you want that it's really easy for them to use your system, try and have it that when you look at the screen, your granny would know what the buttons mean. Because often when it was, we found that some of the reasons that the systems weren't working that well is that people were afraid of what the actions they were asked to do, that they weren't comfortable in doing them.
Maybe I'm just going to ask you to wrap up now if you have one last gem to share with us.
So I suppose I would say that go onto the websites like eHealth Ireland and to look at what ways you can easily start your interoperability journey, and don't think that you have to create everything from scratch. Most countries aren't building motorways, they're just building kind of entrances and exits from the motorway. So you want to see how you can fit into current exchanges that are already there. And that would be my final point.
Super. Thanks so much. Very, very practical advice there. That was very useful indeed. So I'm going to ask, we have 4 minutes left, so I'm going to ask our attendees to put their questions into the Q&A. I have a question straight off the bat for Larry. So Larry, you said that you needed to know what the interoperability factors were for other jurisdictions when you were building your COVID apps. How did you find out what those interoperability factors were?
So the key part is finding the right folks to actually talk to. So it's a totally non-technical question. It really is one of those. So everybody has their key elements that are sitting out there. Typically there is a gatekeeper. They're kind of well hidden, but you need to dig and find who that person is. I think it goes a little bit back to one of Tom's points from earlier. Find the 1 or 2 key people that can actually influence that side of it. Although there are published standards within public health authorities do tend to get a little bit convoluted and can be out of date. You're better off actually speaking to the folks that know on the ground. Okay,
that's great. Thank you. And I just want to ask our attendees, do you have any other questions that you want to pose to our panelists? We have a few minutes left. We've got a question here in the Q&A. So David Connolly would like to know, do you think COVID has increased the competitiveness in the digital health sector?
Who's that to?
Will we ask each one of you maybe to give us 30 seconds on that?
Yeah, so sorry, Larry. Yeah, no, I think it's competitiveness, but competitiveness is a great thing. So I think like the phenomenal things that Nearform have done is they've kind of like basically helped transform digital health from like the worried well or kind of niche market into the mainstream. So now everyone has a digital health solution on their phone, or a huge population within Ireland and globally. So it's made everyone aware, and it made it a lot healthier. And also it's kind of maturing the digital health industry too. You know, so what might seem like competing companies actually do quite significantly different things. So, you know, companies are starting to find their niches, their specialities as well. So and a lot of that's thanks to the great work of Nearform.
And Adi? I'll go straight to Larry and I'll come back to Adi.
Yeah, I think rather than competitiveness, it's created just an abundance of opportunity. So public health authorities, speaking to the folks at the court, they recognize they've now been clearly shown what can actually happen if you put your mind to it, how digital health can actually have an impact. So as a consequence, they are open to change and they are open to that transformation, some more so than others. What it means for us as an industry is just a plethora of opportunity. So, you know, people just need to step up. And sure, there's going to be some competitiveness in it. Not everybody can win at the table, but it's a monster-sized table now for everybody to play at.
Great. And Adi, I'll give you the final word.
I think that there is a huge opportunity out there because people can see the benefits of it. So I don't think it's competitive, and I think interoperability allows us to have more complete solutions. So I don't see it as a negative at all, COVID.
Okay, yeah. Just finally, and I know some people have to drop off now because it's 1 o'clock. Finally, Amar would like to know, is there any initiatives to tackle the interoperability and the barriers to social determinants of health? I'll give that to Larry.
Oh, thanks. From that point of view, there are a bunch of different initiatives going on, and that in itself is a challenge. As we'll need to look at interoperability between the initiatives that are the initiatives to resolve interoperability. So it becomes a little bit of a cycle. But as we kind of said earlier, is we used to have a system where everybody was siloed off doing their own kind of thing. We're starting to see that on a regional and more global basis actually come together and look at standards like FHIR and SNOMED and a few others. We're seeing, you know, some initiatives coming out of Europe and again, federally over in the US. They're looking at how we actually tackle it. So there are a multitude of initiatives out there. No point getting into the details of them here. You need to reach out to folks and see what makes sense for you. There's some solid trends out there, you know, but you need to row in behind the right one for your business.
Okay, thanks, Larry. And I give that one to you because I know from the COVID point of view that, you know, the COVID app needed to be amenable to the entire population, regardless of their digital literacy. And therefore, it was something that you have probably come across. And you mentioned also that 80% of the budget needs to be spent on training and communication, which I think across the board, Sweden has experienced that, Estonia has experienced that. And so it's really a matter of trying to figure out who to talk to, and in the case of COVID, the libraries did a wonderful job in helping older people, for example, with digital literacy. So there are initiatives there, and so you can talk to us, Amar, or your local enterprise office, your Leo, will be able to help you to figure out what the channels to interoperability might be. I just want to remind you folks that we do provide mentoring on each topic that we're covering. So please come back to us after the webinar and ask us to book an appointment if you would like to discuss this in more detail. And also we look forward to seeing you at our webinar next week, which looks into customer need and building your product based on customer need. Okay, so we're 2 minutes over. I'll let you all go and have your lunch, and I thank you very much for your time and for joining our webinar today. We'll see you next week.
Thanks. Have a nice day, everyone.
Take care.